To be diagnosed with male breast cancer, you feel slightly out of your own environment, if you like, unless you've had somebody within your family who's had treatment for breast cancer. I don't think many men realise what the treatments are and what they involved and how long they are. I don't think that they understand just exactly how life-altering the situation can be for you, and that it can have long-term effects on all sorts of aspects of your life.
It's particularly difficult for men because breast cancer is predominantly a women's disease, and there'd be no men that would really ever believe that that could happen to them, and that men actually don't tend to go to the doctor with health issues, and maybe wouldn't want to be seen to be saying that there's perhaps something wrong in the breast area, and would ignore even the symptoms that maybe a woman would pick up much earlier.
The worst thing about having breast cancer as a male is that it's a female disease in many people's minds. There's the shock that you've got cancer, but then there's all the people around who do not know that men can get males can get breast cancer, and so you're having to help people with that as well as the fact that you've got cancer.
Just like women, men should go to the GP straight away as soon as they find anything, obviously in the chest area, either a lump or a swelling, an invasion of the nipple, any discharge from the nipple, particularly blood, and they should actively seek out seeing the GP as quickly as they possibly could. Also, the areas to look are under the arm, where if there are any swelling there, it is an indication that this could be related to breast cancer. Once the man's gone to his GP, the GP then will refer him into his local breast clinic, where he'll be seen by the breast specialist, and that could be a doctor or a nurse. And at that appointment, he'll have a clinical examination, X-rays which may include a mammogram or ultrasound or both. Depending on the results of those two tests that will be carried out on the same day, he may then go on to have what we call a tissue biopsy, commonly known as a core biopsy, where just a small piece of tissue is removed from the area of where the trouble's been seen by the GP and the man, and that tissue then will go off to the lab. In some hospitals, they can turn that tissue sample around within the day, but in most hospitals it can take up to 5 working days. But before the man leaves the clinic, they will leave with an appointment asking them to return to see the breast specialist the following week. The next step would be your treatment plan, and that would be put together by your breast specialist after a multidisciplinary team meeting, and those steps would be surgery, chemotherapy, radiotherapy and hormonal therapy. And those are the 4 ways in which breast cancer are treated. And it may be that you have one of those treatments, a combination of all 4, or just 2 of them. This will be fully explained to you by your breast specialist with a breast care nurse present. At the end of the consultation, we're given some written information and a contact number, so that when you get home, you're reading through your information, something you don't understand, then you've got a contact number that you can ring to verify what it is and what your concerns may be around what's going to happen next, and so that nobody is actually alone once they've had the breast cancer diagnosis.
From when I was diagnosed, I tried to remain positive. My partner was really positive for me as well. I had a lot of friends and family who were very, very supportive, and the people within the Haven as well have been fantastically supportive. And I think if you can go into treatments with a really good positive attitude about it, then I think it just makes the journey through the treatments just so much easier.
We don't actually know why men or women develop breast cancer, but there are some risk factors which include getting older, for both men and women, obesity, particularly in the over 35 group, Previous radiotherapy, if you've had radiotherapy for some other cancer, this can lead to breast cancer later on in life. Also, high estrogen levels from long-term liver damage. And there is a genetic link as well. But that's only a small percentage of people, and particularly you would have to have had 2 first-degree relatives diagnosed under the age of 50. Men will be offered hormonal therapy just the same as women. It obviously does depend on the type of cancer and the results of the definitive surgery to which hormonal therapy they will be offered, but just the same as women, as in tamoxifen or aromatase inhibitors. So again, it may be a surprise, but it would be offered to them if it was appropriate.
Every piece of literature that you pick up I mean, I'm not particularly interested in what kind of bra you wear after you've had a mastectomy, because it doesn't affect me. But that's what the sort of thing that you get in the literature. And so it's a very it can be a very lonely world.
The information for men with breast cancer, there's very little of it out there, so they can be very disappointed and frustrated that it's very female dominated. There's lots of information for bras and prostheses and reconstruction, but for men there's very little, and it is very difficult to access. So I think what we can do here at Breast Cancer Haven is provide some support, some more information, and try and encourage men to look after themselves like we do for women, and hopefully if men know about us and they will access us, we're here to help.
You actually need somewhere where you can come and actually just simply, where people understand, this is how you feel, I am scared out of my box, or, I am just so exhausted, is this normal? Etc., etc. I mean, and here is a place where people are not frightened of talking those things over and dealing with them.
I felt that as soon as I was undergoing my chemotherapy, that I was over the main parts of my treatment, and I think the opportunity to come to the Haven and sort of follow up on some other treatments and supplementary treatments was just a fantastic opportunity.